This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
Okay, great. I think we're all set up. What's going on, everyone? My name is Jeremy Garcia. I'm a third-year PGY. I'm a PGY3 resident at Northwell's program. Today, we're joined with Dr. Colin Chen, who's our current chief. And we're also joined by Dr. Prahr Shah, who's also a fellow PGY3. First and foremost, I want to thank PM&R Scholars for the opportunity to talk about our program. Unfortunately, we're limited in time today. We only have 15 minutes, so we're going to try to go through all the nitty-gritty through the slides. Then we'll do a brief question and answer session afterwards. That being said, if you have any questions during the actual presentation itself, you can feel free to send any questions through the chat, and Dr. Chen will answer your questions over there. All right, so we'll start off with some of the residency highlights. We are an ACGME accredited 3-year program. We are non-categorical, meaning that your intern year is done at a different institution. That being said, Northwell does have a preliminary medicine program at North Shore and LIJ. Your interview with us will serve as a double interview for both the PM&R program and also the prelim medicine program. So you're essentially killing 2 birds with 1 stone, which is definitely a big plus. There are 4 residents per class, 12 total residents, and 2 chief residents per year. There are plenty of opportunity for research and scholarly opportunities, as we'll get into later. Oftentimes we have Hofstra medical students with us. They have it built into their neuro block, so PM&R is a dedicated rotation for them, which is very unique. Another residency highlight is that we have a good amount of elective and selective time, which you'll see later. We have 4 months total, which is incredible. Every single year, we're assigned some mentors, typically in line with our particular interests. Myself, I'm interested in interventional spine, so they coordinated me with Dr. Brian Golden. He's a phenomenal interventional spine doc. He actually won Teacher of the Year this year. Another plus of our program is that we do have a traumatic brain injury fellowship in addition to a cancer rehab fellowship that'll be starting up next year, led by Dr. Martone. So this is a slide of all of our chairs and directors. We have first and foremost Dr. Adam Stein, who's pictured on the bottom left. He's our PM&R department chair, and he specializes in spinal cord injury. Next, we have Dr. Bradford Landry, who we're lucky to have. He's our wonderful program director. He specializes in pediatric rehab. He has a great deal of chronic pain patients within the pediatric community, which is great exposure. He's also currently working on getting all the incoming residents with butterfly ultrasounds. I don't know if you guys heard of that, but it's a huge plus, pretty much for educational purposes. For our MSK curriculum. So hopefully we're anticipated to get those within the next few months. So that'll definitely be set up by the time you guys start. Next, we have Dr. Susan Maltzer. She's our PM&R vice chair at Glen Cove Hospital. She's an amazing asset to our program. If there are any issues within Glen Cove Hospital, she's there to help. She lends a helping hand every single time. And she's very easy to talk to, very easy to get along with. She actually opened up the opportunity to allow us to moonlight. So you help out at Glen Cove Hospital when needed to help out with admissions and phone calls, and you can make a little extra cash on the side. Last but not least, we have Dr. Rosanna Sabini. She's our brain injury fellowship director, who's a who's very nice. She's a pleasure to work with, an excellent teacher. You'll get your traumatic brain injury exposure with her. Not pictured here actually is Dr. Patrick Martone, who we should probably add. He is going to be the cancer rehab fellowship director, which is starting up next year. All right, so we have a diverse faculty within pretty much every single subspecialty. We're lucky because we get comprehensive training in all aspects of PM&R, including neuro and stroke rehab, cardiopulmonary rehab. We have a great variety of heart transplant and liver transplant patients. You get exposure to cancer rehab, traumatic brain injury, spinal cord injury, interventional spine. The list goes on. We do have a large emphasis also on on outpatient MSK and interventional spine as well. But you name it, we got it. So we have various different rotation sites. Glen Cove is our home base for inpatient rehab. Then we go to North Shore and LIJ, which is also located in Nassau County. We do consults there. We do palliative care. We do EMGs over there. We go to Cohen's Children's Hospital for our pediatric rehab exposure. We go to South Shore Hospital located in Suffolk County for consults and TBI exposure. And we have various outpatient sites located throughout New York. All right, so this slide is pretty much to show you that we're mainly concentrated within Nassau County. You can see those 4 stars in the middle of the island. That's pretty much where we're located mainly. That being said, we do have a site in Suffolk County, that far east star, which is South Shore Hospital. And we do have some rotation sites within the city as well, predominantly in like Columbus Circle and East Village. So that's great. So Glen Cove Hospital, this is, like I said earlier, this is our home base. It's located on the North Shore of Long Island. We have a total of 82 beds of rehab beds, which is an incredible amount. And it's expanding as well. We're opening up a new unit soon. We're proud to say that we were ranked in the top 50 rehab hospitals within US News and World Report this past year. You know, we're very grateful for that. We have a remarkable rehab unit, great therapists. We have a great PT gyms with great technology as well. We have a brain injury unit. We have a general rehab unit, post-COVID unit. You get lots of exposure when you do your rehab rotation. Moving on to the clinical rotations. So we spend a year out of the total 3 years of our training doing inpatient rehab. That's pretty much the minimum requirement for any PM&R program. We spread it out quite nicely where you do 6 months of it as a 2, you do 4 months of it as a 3, and then you do the last 2 months of it as a 4. The remainder of your time when you're not on inpatient is spread throughout multiple different outpatient settings. As a 2, you get early outpatient exposure, which is great. You also get a month research block where you work with Dr. Bloom, our research coordinator, to pick a particular topic of interest and hopefully get you started on a project. You get a lot of EMG experience as a 3 and a 4. Like I said earlier, a good strength of our program is you get a lot of elective and selective time. So you do a month of elective and selective as a 3 and same as a 4, which is great, especially when you're showcasing for fellowships and you're looking for letters.
All right, the call schedule. So we do all of our calls in Glen Cove Hospital. That's our inpatient rehab unit. Important thing to note, we have equal call for every class year. So we're not front loading calls on the PGY2s. That way, you know, we're not burning out early. Schedule is pretty much split up between the 12 residents. So again, we're taking, you know, weekend calls maybe like once a month, maximum twice a month. And some weekday calls sprinkled in between. The call itself, so we have 24-hour call, which always is accompanied by a post-call day. So you come in 5 p.m., you know, after your daytime work, whether you're on inpatient, outpatient rotation, or off, and then you come in until 8 a.m. the next day, and then you have the rest of the day off until 8 a.m. the following day. Cool things about call. We have this maybe started like this year actually, or last year. We have a nurse practitioner that comes in to help the residents with admissions from 1 p.m. to 9 p.m. It makes it easier for the day team for prepping admissions and even easier for the person on call. So they have one person to help see admissions as they come in while they're managing the floor as well. We also have a hospitalist that co-manages 24/7 for medical issues. So every rehab patient that gets admitted has a hospitalist managing, seeing them every day. And overnight, we have a nocturnist as well, who we can contact if there's any medical issues that need to be addressed. On the weekends, we have moonlighting available for some of the senior residents. It's very nice to make a little bit of extra cash, but we also get a lot of help with prepping admissions, with a little bit of floor coverage and seeing admissions on the weekend when you have that 24-hour call. And you get paid like $100 an hour, which is nice. Here we have some pictures of the resident working space. We have a really nice resident office workroom, 5 or 6 computers. We have laptops that are dedicated for the residents themselves. Favorite feature is probably the large windows that we have and the AC unit that we can control. So we can set the temperature, whatever we want. Fridge, microwave, snacks. We also have a call room that has a bathroom inside the call room, which is great, with a shower too if you want it. We have lockers, a twin bed, a window, laptop there as well. So education-wise, we have dedicated didactics every week. It's a half day on Wednesdays, usually from like 8 to 12, and then we have lunch afterwards. And after that, you go back to do your outpatient or inpatient rotations. We also have a variety of presenters during the didactics from various fields: radiology, neurology, PM&R therapists, orthotists. And we also have a lot of hands-on workshops where we learn, ultrasound, EMG, Botox for spasticity, Botox for migraine, things like that. And we also attend journal clubs and so a multidisciplinary spine conference, which has neurosurgeons, orthopedic surgeons, physiatrists, therapists, residents, attendings, and fellows as well. So we get a good variety of education throughout while we're doing the other inpatient and outpatient rotations too. Regarding research, as Jeremy mentioned, we have 1 month of dedicated research block as a PGY2 year. We have really good support from Dr. Ona Bloom, who's the director of research over at the Feinstein Institute for research. She specializes in spinal cord injury research, but she is always available to help guide any projects that we go into, whether it's getting IRB approval, statistical analysis, or even study design. Really an excellent resource that we have. Regarding conferences, we do have various residents that go to conferences, submit abstracts and go. We do get conference stipends if we are presenting something at the conference. And as a PGY4, they also fully cover attendance, that's travel, and attendance at the AAP conference. We'll go over some of the memberships that we get as well later on. So the Brain Injury Fellowship, as Jeremy mentioned, is run by Dr. Rosanna Sabini. Really great attending, super helpful, super nice. We get exposure. So as a resident, we get to work with the fellow, and we also have brain injury rotation with Dr. Sabini. And as a fellow, you also get exposure to the brain injury unit, trauma consults in the ICU, medical floors, concussion clinics, spasticity management, and also the fellow does a research project and electives as well. And next year, we're having a cancer rehab fellowship start up. And that is going to be geared towards, learning about treatments for impairments related to cancer and cancer treatment, things like lymphedema, peripheral neuropathy from chemo, things like that. And it's going to be at Monterey Cancer Center and Inver Cancer Center and possibly another site too. But it's going to be run by the, Dr. Martone, Cancer Rehab, and Dr. Malser as well. So residents and fellows, so this is the most recent picture of our current class. We have our fellow, our PGY2s, 3s, and 4s, as well as some of the leading faculty. We have a mix of MDs and DOs, and we have a mix of, locations too. We have people from New York, Jersey, couple from Florida, recently from Canada as well. Typically, when we're as residents here, I think the majority are living somewhere in the Manhasset, Port Washington, Great Neck area, but we also have a couple that are in like Brooklyn, Queens. We do have a lot of social events too throughout the year that's mainly organized by us, but we also have wellness days that the program gives us too. Here's some pictures of some of our resident events, a lot of restaurants, a lot of food, some drinks too. We have a white elephant on the bottom left. We've got a lot of different cool stuff. We had Top Golf as our wellness day last year, funded by the program. So they gave us a couple hours of Top Golf and some food. Overall, we're doing a lot of stuff outside of rotations too. This was really cool. We had this year we had a barbecue and pool party hosted by our program director. So that's us in his pool. Overall, we definitely have a good relationship with a lot of the faculty, and all the residents get along well with each other, which is really nice. Regarding places where we match, we have a big variety of specialties, definitely a little bit leaning towards pain and sports and spine, but that's more just because that's where the interest was for all the residents. We're matching into well-known programs, like Memorial Sloan for cancer rehab, spinal cord injury, Rutgers Kessler. We have Cornell, UPenn, UMich for pain, OSS, and Rutgers for sports and spine too. So a good variety for sure. Here is some of our data from the most recent ACGME survey, kind of comparing and seeing what residents think of the program itself. We're well above the mean, well above the national mean as far as satisfaction with the program. 92% of our residents had a very positive overall evaluation towards the program. And some of the additional benefits that we get. So I don't know if Jeremy mentioned this, but we do, Northwell salaries are definitely among the most competitive salaries that we get. You know, as a PGY2, you're making $77,000, goes up by $2,000 every year. You get a little bit extra if you become chief in the PGY4 year. We have 2 chiefs every year. And they also give us membership to AAP, PM&R, the program funds, and PM&R Q Bank. We get a Pocketpedia when we first start. We also get some reimbursement for conferences. We get an academic allowance for educational material that we can spend as we want. It's like $300, and we get 20 vacation days, pretty standard, as well as a couple wellness days that we can split up, and some sick days as well. Now we'd like to open up the floor to some questions. Feel free to type in the chat, unmute if you need to. We also have our contact information here. We'll also type it at the end so that you guys have it. Feel free to reach out, email us. We're happy to answer any questions you guys have.
Zucker, you have 2 minutes.
All right, can you pull up that email slide again? Just make sure that everyone gets it. Yeah, I've been answering questions as they've been coming in the chat. If you guys have any more questions, now's a good time to ask it, or you can always shoot us an email. Yeah, any one of us can answer the question equally as well.
Same question I've been asking. Is there any particular patient population that you feel like your program gets a lot of exposure to? Yeah,
I think, I don't know if it's because of the interest of our residents. Dr. Landry is really open to hearing, what specialties our residents are going into. It just so happens that we have a lot of pain exposure. A couple of our attendings are interventional pain trained. We have rotations with them. There's a sports and spine rotation as well. So if that's something you're interested in, that is, I would say, one of our strongest suit. Okay.
Thank you very much. Appreciate it.
No problem. So Amara asks, what do you enjoy most in your program? I think it's the people. Like we honestly love hanging out with each other. Next week we're going out for Indian food at Bayside in Queens. We play spike ball together. We a lot of drinking. But oh, actually no, sorry. Some of us are choose not to. But anyway, our relationships with our attending is great too. I think on the 20th of this month, we're having a big pool party at one of our nurse practitioners' house, and all the attendees and residents and faculty are invited. We also had a recently big pool party from Dr. Landry, our PD's home too, and he has a ginormous pool. Definitely check it out.
Zucker, thank you so much for participating.